Hey there, I put my references underneath the video. I use the textbook and the two YouTube videos. Discuss key factors that define adjustment disorders. Using identifiable stressors, behavioral and emotional response to these stressors, interfering with daily life, like they're out of proportion with what the person is facing. Symptoms appear within about 3 months of the stressor and resolves within about 6 months or after the stressor ends. Significant impairment would be interfering with social and occupational and also education. Excludes other disorders. The symptoms are not better defined by another mental health disorder like, per se, anxiety or depression. Vulnerability would be a personality coping skills like past experiences or memories and how long they're reacting to the stressors. Specifiers or six subtypes would be defined in the DSM that's provided with six subtypes of adjustments disorder by specific categories. With depressed mood, with anxiety, with mixed anxiety and depressed mood, with disturbance of conduct, with mixed disturbance of emotions and conduct, and unspecified. Indicators of why these are occurring, for example, would be situations like ending a relationship, painful illness, marriage issues, seasonal business crisis, crime that is extreme in your neighborhood, starting school that's new somewhere, progressive disability, getting married, not meeting work expectations. From a diagnostic feature perspective, what constitutes having diagnosis of adjustment disorder more than other trauma-related disorders? Can having a significant life-changing events cause trauma? Why adjustment disorder and not the others? Well, they might have an overlap in the symptoms and key factors. The stressor is identifiable and limited duration within mostly 6 months or the absence of the stressor. It can experience anxiousness, impulsiveness with rebellious actions, crying, helpless feelings, sadness or trapped feelings, lack of concentration, withdrawn, suicide risk, loss of self-esteem. Physical symptoms could include indigestion, trembling, insomnia, muscle twitching, feeling sore, body pain, or fatigue. Why is it important to have the specifiers and modifiers present in listing any of these diagnoses? Well, if the duration is longer than 6 months, they could qualify for a different category. Often it's been said it's been misused, the diagnosis, not in the mental health field itself because of the mental health criteria, but because of the people that work in the mental health field. 5 to 12% have been diagnosed, but 50% have been diagnosed in the hospitals. Not anyone can just have it at any time, any disorder at any time. Their persistent stressor has to be there with a chronic disabling or other condition. A stressor with enduring consequences, financial and emotional difficulty from divorce, and the duration of symptoms are indicated by using acute or persistent chronic specifiers. Acute specifier would be used indicating the stressor that's less than 6 months. Persistent chronic specifier is used to indicate a level of persistence in symptoms of 6 months or longer. A duration of longer than 6 months in response to a persistent stressor or a stressor that is ongoing, like I said, could be a different situation and can help with grief, can help happen from grief, also divorce as well, or having many losses. It's another examples that I forgot to mention. But they can have treatment through therapy and medication, and Xanax is one of the medications. And there's also non-benzodiazepines. But that's about it. Thank you so much.